If it's happening, we're covering it on the doctors.
Coming up next, an athletic superstar struck down with a debilitating disease.
She's been to the point saying, just cut it off, just amputate it.
Samantha was an extremely active person chasing her dreams when an accident took it all away.
My name is Samantha, and I'm 23 years old. Growing up, I was an extremely active person. I was a competitive gymnast.
She spent 20+ hours a week practicing.
I was state champion multiple times. Out of high school, I enlisted in the Air Force.
She was so excited. She worked really hard to get there. She had her whole life, her future planned out.
During basic training, I was running, and right as I crossed the finish line, the pain in my legs was so bad, I collapsed. They took x-rays of my legs, and they said that I had fractures from the knee all the way down to my ankle in both of my shins. The doctors told me to stay off of my legs for 3 months, and they placed me in a wheelchair. My job was to go out on the flight line and refuel the planes. But being in a wheelchair, I was stuck doing paperwork. The left leg never fully healed, and I was left with constant pain. A doctor diagnosed me with CRPS, which is complex regional pain syndrome. I have been in excruciating pain, a pain I never could have even imagined. Anything touching my leg feels like sandpaper on a sunburn. It's debilitating. I can't do anything. As a result, I was forced out, being medically retired from the Air Force, literally having my life ripped out from underneath me. I haven't lost hope. There has to be an answer. But I'm desperate. I'll do anything to get my life back so I can live a life as a normal 23-year-old.
We're now joined by Samantha as well as her mother, Kathy. And Samantha, I'm sorry you've been through so very much at this young age. What is it like day to day with the level of pain?
Just a constant burning pain. It never goes away. Anything from the softest blanket at night rolling over it, or even wind hitting it. It's trying to put on pants. It's like rolling an iron, a hot iron up your leg. There's been days where the pain is just so bad. Every move I make is excruciating that I just think my life would be better if I didn't have that limb anymore, because it's the worst pain that anybody could ever feel.
You know, we've talked about CRPS on the show before, and the first word, complex. It's a complex problem, very difficult. It can be difficult to diagnose, very difficult to treat. We actually sent Samantha to pain specialist Dr. Timothy Davis to try to find some answers.
I've heard a little bit about your backstory. What kind of treatments have you had?
I did several nerve block injections, spinal cord stimulator, which didn't help that much. Currently, I'm taking oxycodone, 15 milligrams, 4 times a day, and that helps a little bit to where I'm able to get out of bed, but not enough to really live my life.
What can you do actively with this leg?
That's fine. Here, that is using every effort and muscle that I have.
I had a chance to review your records, and one of the main concerns I have is you have a history of a couple of blood clots.
The first one was right after the compartment syndrome test. Recently, I was in the ER with shortness of breath. They found 6 or 7 small blood clots.
I have a couple of potential options. Before we can even go into those, we have to make sure you're healthy. I need you to see 2 specialists. If you can see both of these specialists and we can get you tuned up, then I think we can probably offer you something to help with your leg pain.
You know, as so often happens in medicine, after Dr. Davis met with Samantha, he contacted us. He had some concerns about Samantha's health when she revealed that she had 2 blood clots, one right after her injury, then another blood clot 2 months ago. The reason that this is a big concern for those of you watching is when you develop a blood clot, let's just say in your leg, a deep vein thrombosis, that blood clot, as it forms, has the potential to break off. The other concern is, for someone like Samantha, is why is she getting all of these blood clots? But because if she went in and had anesthesia for 4 hours, for instance, she could potentially develop a blood clot. If it breaks off, goes to the lung, pulmonary embolism can be life-threatening, if not deadly, because any area beyond that blood clot, blood flow does not get to. Dr. Davis was concerned, we were concerned, so we put together a team of specialists to see if Samantha has any blood clots or if she's at risk for developing them while under anesthesia.
Today what I'd like to do is to order a full complete workup of your blood analysis to see if there's any underlying tendencies for you to develop blood clots spontaneously. I would also like to do a CAT scan of your chest to make sure there's no residual blood clots left over from a few months ago, and also a CAT scan of the venous system called the CT venogram of your legs. And if any of those are positive, then we can sit down and talk about what it means for you.
Thank you.
Dr. Davis, as you know, referred you to me to clear you for any procedures that are required to help you with the pain in the leg.
Okay.
We're going to do 3 tests for you today. The first one is an EKG, which shows the rhythm of your heart. Then we're going to do an ultrasound of your heart, otherwise known as an echocardiogram. And finally, we're going to do an ultrasound of the leg to make sure you don't have a vein thrombosis or a clot in the leg.
Okay.
You look concerned.
Yeah, just with the ultrasound of the leg, because anything that touches my leg, from even having long pants to the wind blowing on my leg, is extremely painful.
Okay, I understand. I'm going to help you through this.
Okay.
Go ahead.
For her to let them do that is very brave. She knew the amount of pain that was going to cause. That just tells you how badly she wants it fixed. She's been to the point saying, you know, just cut it off, just amputate it. That's how bad the pain is.
And Samantha, I know recalling going through all those studies is very scary. You don't know your results yet. And we're going to reveal Samantha's results when we return.
Coming up next.
I haven't lost hope. There has to be an answer.
Desperate and afraid, it's Samantha's last chance for a cure.